I get this question all the time. What can and can't I do when I'm pregnant? Let's talk a little bit about it. The first thing that I really want to send home to patients who are pregnant is that you have a superior advantage in one big way, which is that the volume of your blood is increasing by about 30%, which means you have so much more circulation going on. You're rich in amazing vitamins and tools that your body is essentially a miracle creating. One thing that is fantastic when you're pregnant is doing PRP treatments. Now, this is, of course, provider specific, patient specific. There are patients who are pregnant who I wouldn't do this to. But in general, with PRP, where we draw your blood, spin it in a centrifuge, take the red blood cells out, and then what we're left with is your liquid gold. Your liquid gold when you're pregnant is so much better than when you're not pregnant. Anybody who's pregnant has these superpowers in them. They have so many more growth factors, stem cells, reparative abilities. I have a patient who had cystic acne. We were working on it, then she got pregnant. We said, okay, we can't laser anymore. We can't do, injections with medications anymore, but what we can do is some PRP, and let's just see if your body can heal itself. Her skin is perfect. She literally healed herself, or her baby healed her. I don't know, however you want to think about it, a little sentimental. So PRP is a definite when pregnant, barring that you pass a few other clearances. Things that you can't get when you're pregnant are laser therapy, Botox, fillers. Now, the reason why behind this is because nobody wants to study any of these things on a pregnant person. Nobody wants to take the risk of, let's see if this does affect pregnancy or it doesn't affect pregnancy. So nobody is performing these studies. When it comes to retinol, there are many providers, including OBGYNs, dermatologists, who say retinol is perfectly safe during pregnancy, other providers who say it isn't. What I think about when I think about retinol is, well, what is retinol? Retinol is vitamin A. Vitamin A, when consumed in large quantities, like vitamin A is in carrots, but nobody's telling you to not eat carrots when you're pregnant, right? Okay. Vitamin A in large quantities, you can have vitamin A toxicity. It would be very hard to do, but it's possible. You can't have toxicity with vitamin C, the B12 vitamins. There's no toxicity there because they're water soluble, and anything extra, you're just going to pee out. But with the vitamin A, there can be a toxicity. Is there possible to have a toxicity of vitamin A from doing one pump of retinol topically where it's not even going systemically? You decide. I think that's a decision that you make with your OBGYN or your dermatologist when you're pregnant, but that is what you're thinking about. Take away some of the anxiety about it and just think, okay, this is a vitamin A product. Things that you definitely don't want to use are like hydroquinones. There's sort of this scope, this umbrella of what people are comfortable doing and not comfortable doing when they're pregnant. And a lot of it is individual, because what we don't want when we're pregnant is to have high anxiety. So we're doing things because we're doing it, we were told it's okay, but it's making us stressed out. Don't do it. Don't do it. Stress will affect a pregnancy more than anything else. You don't want high cortisol levels. You want to be calm, cool, collected. When I was pregnant with my second child, I was in France living there with my husband. And so I did my prenatal ultrasounds there, and they were so much different than my experience of being pregnant in the US. In the US, they say, no alcohol, no cheeses, everything else, no sushi, no deli meats. In France, it was a totally different experience. What they were saying to me is limit 1 to 2 glasses of wine a day. No raw vegetables. They didn't want me eating any salads whatsoever. Don't threaten me with a good time. I was like, okay. The pasteurized or unpasteurized cheeses, they just said limit it, keep it, smaller quantities per day. They didn't say anything about sushi, nothing about fish. So it was interesting. It's interesting and it's different. And I think that what's most important is that you're making decisions that feel right for you, that keep you in a calm state of mind. Typically when I was pregnant with my first child, I didn't eat anything that was on the list. And then by my third, I was like, yeah, I'm having sushi. So listen, judge me, don't judge. It's individual. You have to feel good within yourself. But those are your pregnancy recommendations.